Welcome to Bionovis. We now begin an immersion in the fundamental stages of the production of our biological medicines in which innovation comes to life. Our production journey begins in the upstream process with the thawing of the cell bank cryotube, which is stored at low temperature in dedicated equipment. It is from these cells that biological active pharmaceutical ingredients, or APIs, are generated. After thawing, the cells go through the cell expansion process, in which successive stages of cultivation occur, with a gradual increase in volume and production of a greater quantity of cells. After cell expansion, the cells are transferred to the production bioreactor. In the bioreactor, cells are maintained in ideal growth conditions through the control of various cultivation conditions, such as temperature, agitation, pH, gases, and nutrients, so that they multiply even further, culminating in the production of API. After achieving the desired productivity in the bioreactor, the API goes to the downstream process, in which the purification steps will be carried out. In the first purification step, the API is captured in a resin, its impurities are eliminated, and it becomes a more concentrated solution. It then goes through other chromatography methods, which separate the API from impurities related to the product and process. The purified API undergoes a solution change and reaches its final formulation. Once formulated, the filtration process takes place to reduce the microbial load. This API is then bottled and stored at low temperatures until it is sent to the fill and finish process stages. At the end of the downstream process, the formulated API goes to quality control, where it undergoes thorough analysis to ensure that the predefined specifications were met, ensuring the quality, safety, and efficacy of the product, which is then released for use in the next step. The fill and finish process begins with thawing the API, followed by a homogenization and filtration stage with the aim of guaranteeing the sterility of the product. Filling can be done in predefined volumes, in syringes, vials, or carpuli, ensuring precise dosages of the biological medicine in each container. After filling, the visual inspection stage takes place, and subsequently, the API goes through a careful quality control analysis panel when it is released for commercialization and use. Next, the biological medicine is labeled and packaged. Our entire process follows good manufacturing practices, which apply from receipt of raw materials to storage and dispatch of the finished product, therefore guaranteeing rigorous quality standards to ensure the efficacy and safety of our biological and biosimilar medicines. Finally, the medicine is stored under appropriate conditions until it is distributed throughout Brazil. Distribution is carried out through transport under controlled temperature conditions, which guarantees the quality of the medicine until it reaches the patient. At Bionovis, we are committed to sustainability and the safety at all stages of the production of biological medicines, from the conservation of natural resources to the implementation of good, responsible social practices combined with strict governance. Together, we build a safe, healthy, and sustainable future. Thank you for joining us on this journey. See you next time.